Hi everyone, I'm Makfile, a marketing assistant at BISS, Brightlands Institute for Smart Society, and today Mian Aus, who is a researcher at BISS and he specializes in law and data science. We invited André Dekker to share with us and tell us more about the personal health train project he's been working on, and also give us more details about the award they recently won. So congratulations and welcome.
Thank you. Thank you. Good to be here.
Congratulations, André. And yeah, if you can please tell us more about the Computational Award that you have got. What is its equivalent actually? Is it a Nobel Prize or an Emmy Prize for computing?
Yeah, so it is the major ICT award in the Netherlands, right? It's the only one really we have. It's being awarded by a journal, a magazine called Computable, which discusses ICT matters, obviously, given its name. And it's an open competition, so you can submit your project, and then they nominate 5 people to go through to the second round. And the second round has 2 elements. One is voting by experts, and one is voting by the public. So the public voting started, I think, in September. And then a couple of weeks ago, we received the news that indeed we won the award. And we not only won it, we wanted both the experts and the public thought our project was the best in the health category. So that's great news, yeah.
This is amazing. And like when we think about the name of the let's call it a technology that you have created, personal health train. So what does it refer to actually? I mean, like how is the name connected to the technology?
Sure. So the personal health train is a project, is a movement almost. It's not just a technology, it's a set of principles almost on which we build technology, which we started in the university more than 10 years ago. And the problem we are facing was the following. We wanted to analyze data from patients across the world, right? But if we asked the hospitals around the world, please send me your data, then they always refused because they said, well, I don't have the time and it's private data. I can't send you all that data to Maastricht. So we were forced to think about a different solution where rather than putting all the data into one spot and analyzing it centrally with certain questions that we had to send the questions to the data. So rather than sending the data to the questions, we sent the question to the data. And so in the beginning, that meant a lot of traveling. So me and my team went to hospitals in Sydney, in Toronto, in Shanghai, to analyze their data with the questions that we had. But of course, that doesn't really scale well. So we decided that we needed an infrastructure for that, and together with companies like Siemens and Varian, we developed that, and we developed it along the metaphor of a train. Right? The idea is that okay, every hospital in the world will become a station which has data, and a researcher has a question which we call a train, right? And now we need to send the train to that station to answer the question. So rather than data leaving the station, the data stays inside the station, and a train, which is a question, enters that station and answers that question. And now the answer is shared to the researcher, but not the data. And typical questions that we, for instance, ask is, okay, what are the factors determining survival after lung cancer, right? That's a question that you can send it to Shanghai, and that train asks, what are the factors? And so the answer that the train gives back to the researcher is like, its age is important, size of the tumor is important, your general condition is important, and you get that information, but you don't get the individual data. And that is the metaphor of the personal health train. There's one thing missing, because you can figure out that if a researcher sends a train, so an application, to a station, to a hospital, and starts enters that hospital and starts doing something with the hospital data, the hospital needs a lot of security that this train really comes from that specific researcher, that the train only asks for data that they're allowed to ask for, that the question is an ethical and legal question, right? And this is where the track comes in. So the track is the piece of the infrastructure that monitors the train, that guides the train to the station, that makes sure that the train is allowed to enter the station, that it comes really from a trusted user, and so forth and so forth. So this track not only does the technical governance, but also the legal and ethical governance of the whole system. So that's the personal health train. I know it's a long story, but if I have to pitch it for layman, it's very simple, right? We analyze data from hospitals without the need for that data to leave the hospital. And that is way better in terms of privacy. And that's why we got the award.
All right. And I'd like to ask, so what kind of technology do you use for this to make it happen?
So we use a lot of semantic web technology. So in this, we all know that there's something like called the web, right? The internet, where you can, and if you think about it, we think it's easy, but if you type in something in your browser, you suddenly enter a data station somewhere in the world where it's hosted. It can be Shanghai, it can be Australia, it can be Heerlen. And you get data or information, I should say, from that server, right, in your browser. So that is very much a federated system where data stays more or less in the server it is, and you have a viewer, a browser code that can access that. Now, that's web technology. Now, in the semantic web technology, the same people behind the web are organizing web pages which don't have things like text and pictures, but have data, a database, right, that you can query. And it's that technology that we're using because obviously the web has been proven to work well, and the semantic web also allows a hospital to create an internal web page, if you want, with their data, which stays inside your firewall, inside your hospital. And then a train comes in and queries with semantic web technology that web page. That's the core technology, and that is also the underlying technology for something called FAIR data, which stands for findable, accessible, interoperable, and reusable data, which tries to also internationally gain momentum for, okay, if we want to use data in science, we have to make the data fair. And semantic web technology is a very important component to make that data fair. That's one component. The second component is that we use a lot of what's called ontologies, right? Ontologies are knowledge systems that describe, for instance, lung cancer. What is lung cancer, right? Somebody has to define what lung cancer is. And also has to define, okay, what we call lung cancer, which is a certain disease of the lung, which is a malignant neoplasm, is called longkanker in Dutch, and it's called eteroplasia del polmone in Italian, right? So ontologies help to make data language independent and machine readable. So that's a component that we need as well. And the third important component that we need is the cloud and containerization, right? To be able to send a train, you have to, that's an application. That's an application that asks a question and does something. It's software. And nowadays we have things called Docker, and which are containerization technology that allows you to put a question into a Docker, into a container, and send it via the cloud somewhere else. And also, so that's a piece of technology that we use a lot. So it's a combination of quite new technologies that we glue together to create the personal health train.
This is fascinating actually to listen to. Now, like, what are your coming like plan for implementation of this technology? Are you going to do you have a big scale projects coming on, or are you planning to do so, or are you planning to develop it? So what are the options there?
It's a good question. So So we got the award amongst others because Computable thought, and it's true, that the technology is now mature, right? It's mature enough to say this is really something, right? It works, it's been shown to work. And now the next step that we're working on is using the technology to create a national, but I'm sure at some point international, but first of all, national Dutch health data infrastructure. So in which all the data from all the Dutch hospitals, but not just hospitals, also, of course, health data is being produced by people themselves, by general practitioners, by many other entities, that we create a public utility, if you want, of health data that we can use for research, but also citizens themselves can use for their own reasons. Companies may be able to use, governments, policy settings. That's the next step. And we are doing this even not just for health, but for the country as a whole, because you can think of, okay, such a data infrastructure is also of use for banks, for security reasons, for agriculture. You know. This is all part of something called the Netherlands AI Coalition, which has kind of said, yes, these federated data infrastructures, like the personal health train, they are the way to go. And that's now being, they have taken up the personal health train and shown that it works for COVID-19, right? Also an important question where you want to analyze large amounts of data which is spread around the world, but we need all each other's COVID data to understand, for instance, are these public health measures going to work, right? How are we going to, are enough people vaccinated? Where are pockets of new breakouts? All those questions can be answered with such a system, but it's extremely sensitive data as well, not just inside a country, but also between countries, right? So the AI Coalition has tested that for COVID-19 and it works well. And now we're scaling it up for the whole of healthcare, or health, I should say, but also outside health. So that's a very ambitious thing, obviously. But yes, it looks like it's going to work, and many partners are now accepting that this is the way to go. Yeah.
Like I want to step back to the technology, and actually, as a lawyer, it triggers me always to ask those questions. So I have read recently a report about the personal health train, and in that report, they analyze whether it is privacy preserving or not, and then they concluded that it is actually it must abide by GDPR because it falls within the GDPR requirements. So
Sure.
what do you think about this issue? I mean, like, isn't it kind of how to put that nicely, like it undermine what you are trying to do?
Not at all, not at all. So first of all, I think the goal of a project should never be to try to get away from GDPR, right? Because that law is fine, right? It protects the rights of us all. And so being outside of GDPR is not at all a goal that we're trying to do. I think what the report that you mentioned was made by the Zorginstituut Nederland, or commissioned by Zorginstituut Nederland, right? What it also says is that compared to the current situation where lots of data is centralized somewhere, this federated solution is way better, right? It is privacy preserving, or more privacy preserving by design, right? It simply has that mindset. And at least the privacy concerns are less, right? But I agree with you that it doesn't mean that the GDPR doesn't hold. And I also wouldn't know why we would be concerned about that, right? I think what we really want is an ecosystem of data where citizens have full control of their data, can decide themselves to allow a train to answer a question, but also reject questions to be asked to their data, and maintain full control, which is the GDPR principles, right? Lots of them are about control and being able to say no to your data being used. And we fully embrace that in the personal health train, right? We really think citizens should be able to exercise those rights. And so, no. To answer your question, are you concerned that we're being considered as being GDPR? Well, I guess more compliant, but also there's always additional contracts to be needed and agreements and concerns. Yes, I'm not concerned about that. I think it's a good thing, and we should show that actually GDPR is much easier implemented in such a system and can be more trusted by citizens than any other system out there.
I have the last question. So you named many reasons how can it help research, medical sector, and so on, but could you specify and give us more detail? How can it improve lives of citizens and the society itself as such, the general audience?
Sure. So there is an ultimate goal in the personal health training, which is to create, and some people call it personal lockers, some people call it pods of data, where the whole infrastructure is based on your pod of data about yourself, right? And that can be health data, it could be Facebook data, but that a citizen, an individual person, has all the data under control of themselves, right? That's the final goal. And so the fact that we're now working with hospitals is, for me, an intermediate step. In the end, you need it to be personal. So what does that mean for citizen? It means that as a citizen, you have control about all the data that other people have noted over you. And you can use that data for many reasons. You can decide, first of all, to not use the data, right? That's also important. But also you would be able to share that data because you are going to go on a holiday with a friend, and you want that friend to know what medication you're having or what disease you have, because that person may need to talk to a doctor when you feel ill at holiday. So you may be temporarily allowing access to your friend. But you also can deny that, and you may be able to use your data for a clinical trial or for a research question. You might donate your data for a certain thing. You might use the data for your own health and say, well, how can I improve my health? Can I download an app that works on my data and says, look, if you're really concerned about, losing weight, then this is, in your case, very personalized, AI-driven, what you can do best, because it's proven to work in others. So for a citizen, by having control of their own data, suddenly many things are possible, which are not possible now. So I think that will be the final goal, that the citizen controls their own data and can pull trains to them that they find interesting for their own reasons. And that's the ultimate goal.
Thank you.
You're welcome.
I realized that Johan van Soest has just joined us, and it's great to have you here, Johan. Johan is like one of the creator of Personal Health Train, and like we were supposed to have him while we are hosting Professor André Dekker, but like because of some overlapping meeting. So can you tell us more about your role within this this great thing that you have done?
So my role in the whole personal health train is on the research side, but more on the technical side. How do we get these trains actually running, right? And there in that part, I'm more involved in the research. How can we make the data available within stations? And how can we make an infrastructure, let's say the tracks for that for these trains, and that we can execute these trains, and what's needed for that to let them run, basically. And from that perspective, what a personal health train does is you can compare it to something very similar with an email, for example, right? If I send you an email, you'll receive it, and maybe it says in the attachment, hey, can you please, or in the email, hey, can you please run this attachment for me and send the result back, right? And the first 3 or 4 questions which pop up to you is like, hey, do I know this person, right? Second, do I really understand what this attachment is, and do I allow that to execute on my computer, right? And the other one is, if I see the results, do I want to send this back, right? Is that and is it on a safe communication channel and these kind of things? And this is also what we see that hospitals have questions about, right? How do we really address these personal health trains, and how do we make sure that everything's safe and working, right? So more or less, that's where the research is about on the infrastructure side. How can we make this infrastructure, as André already outlined, how can we make it as safe and secure as possible to work with? Because even also, if you bring it to the individual patient, and patients can invite trains to do something on their data, they need to have trust in some way in that system as well, to say, okay, I understand what this researcher is doing, and someone checked whether that researcher is actually doing in that analysis what he promised to do, and nothing more, nothing less. All these kinds of questions play in there, and that's still something we haven't yet fully crystallized, let's say, to be honest. But we see that at least within the current scope of doing medical research, this is already possible, and we have made several safeguards and security checks to make this possible.
I could just ask to finish, Johan, what would you say now is the current state of the project, just to give us a brief idea?
Okay, maybe first of all, the personal health train is not, let's say, one individual project, right? There are many different projects which are trying to do or trying to run a personal health train in different settings, in different, let's say, collaborations. You have them on hospital level, for example, and then comparing hospital data to, for example, data from Statistics Netherlands as one option. Or analyzing that. You have projects, especially in radiotherapy, where we want to combine from different hospitals the same type of patients, right? To compare whether treatment A versus treatment B works better, for example. So there's no, let's say, one uniform personal health train project. However, we are working together in the Netherlands, at least under one umbrella, as the personal health train, and that's where the Computable Award was also sent from, as that umbrella, basically. And internationally as well, within radiotherapy, but also within, let's say, also outside of radiotherapy as a GoFair implementation network, which tries to do that as a worldwide consortium, let's say. So there are many parties involved which are having their own individual projects, and they're all targeting different goals, but keeping the same paradigm, let's say, in mind, keeping in mind that we want to send as much of the times the trains with the analysis to the data, analyze it over there, and only get the results from the analysis back. That's the main goal, and different projects are trying to do that in different ways, of course, on the technological level, let's say. But let's say how far it is that for research purposes, we can definitely already use it, and have shown that also in different research projects that we can run these personal health trains. It's more that we are now at a phase that we need to scale it up, that it's clear for everyone how it works, and that it's not only for, let's say, the technical researchers that they can work with it, but also the more clinical researchers, or even patients or patient representative groups themselves, right? And I think that's at a phase where we're heading, but we're not there yet at the moment.
I think we can finish off. So thank you so much. It was very nice talking to you. And yeah, we'll be waiting for more updates and share them soon.
Yeah, thank you very much, and congratulations again. Professor André Dekker, Professor of Clinical Data Science, and Dr. Johan van Soest, Medical Informatics and Data Science Researcher at BISS, Brightlands Institute for Smart Society. Thank you for joining us.
Thank you.
Thank
Thank you.